We are talking with one of our patient. His name is Mr. Barry Gill. We gave a treatment for him. He was prostate cancer patient, and treatment which we did is immunotherapy. So in immunotherapy, we did a special kind of immunotherapy is a dendritic cell therapy. That is a kind of active cancer immunotherapy. So basic fundamental principle of the immunotherapy is to boost immune system by different ways. We can use antigen to raise the immune system, or we can give immune drugs. But the treatment which we are doing active cancer immunotherapy, and in that specifically we are presenting the antigen to boost the patient's immune system. So this dendritic cell therapy is a autologous treatment where we are using patient's own cells and patient's own biopsy or an antigen from the cancer's specific tissue. So this treatment is this is autologous treatments, and there are a number of clinical trials conducted, and safety is also already established of this treatment, and US FDA gave approved in 2010 for this kind of treatment. And recently in 2016 Indian FDA also approved for dendritic cell therapy, especially for prostate cancer and other clinical conditions also. So we are talking with our patients. So his name is Mr. Barry Gill. Mr. Barry, so we want to know your experience about this treatment. So can you let us know when it was diagnosed?
Yeah, I was diagnosed with prostate cancer in August of 2017. I had never checked my prostate before that, and PSA test showed it was 48.9. So my doctor immediately sent me for a biopsy, which showed it was cancerous, and then the next step was he referred me to a surgeon, and he basically scheduled the bone scan and an MRI, and after that was established that the cancer was contained in the prostate. He scheduled the surgery for November of 2017. After the surgery, I was recovering well, but my PSA started to climb again, and he referred me to an oncologist. I visited the Renal Cancer Treatment Center, and I spoke with an oncologist there, and after going through what radiation does, I asked him if there was any alternative, because at that point in time I was a little scared and I didn't want to do radiation or chemotherapy, and he recommended me to Dr. Bora here. He told me there's something called immunotherapy. It has been around for a while, and he would like me to come and visit Dr. Bora with an open mind and talk to him. So that was the next step, and after talking with Dr. Bora, it was like, yeah, this is what I want to do. I'm going to let my immune system deal with it. So there was a series of preparations, some blood tests to be done before, and then Dr. Bora had gotten my biopsy, and he worked his magic on that, and then he had scheduled me for 3 vaccinations. Yeah, 3 vaccinations.
Yeah, so what basically we did, we take his blood and separate from the blood we separate some lymphocyte. Lymphocyte specifically, not lymphocyte, we separate the monocytes from that, and monocytes we grow in the laboratory, and these monocytes we convert specific growth factors, we differentiate them into a dendritic cells. So after differentiation, we prime those dendritic cells with patient's own antigen. So they will convert into mature dendritic cells, and we give back to Mr. Barry. So 8 days we require to prepare it. So likewise we did 3 cycles. Can you let us, do you find any side effect during the infusion or after the infusion?
No, I think after the first one, I felt a little tired, but I was able to go to work. I didn't have to take time off from work. I went to work as normal, and my functioning was as normal. So I really didn't have any side effects.
Okay. And when we was giving the vaccinations, after a few days we are sending him for the follow-up test, like to estimate the lymphocyte, how much lymphocyte we can able to activate these dendritic cells, because ultimately principle of this dendritic cell is they have to activate lymphocytes, especially cytotoxic CD8 cells that is supposed to kill the cancer cells. So after we are doing the follow-up test after every vaccination. So we did follow-up 3 times.
Yes. Yes.
So how many you got? 3 infusions?
I had 3 infusions. Yes.
Yeah. So once we finished the treatment, after some months we did the scanning, PET scan, that can give us based whether recurrence of the cancer is there or not, or how much we can able to do the we can able to kill the cancer cells. So we found the PET scan shows is a normal imaging. There was no any cancer cells which were found after doing the PET scan. So you did in the United States, right? Because in Trinidad we don't have available PET scan.
Yeah. So I was able to contact imaging consultants in Florida.
Okay.
And they did the PET scan.
PET scan. Okay.
Yeah.
So it was normal.
Yeah. I mean, the people there was very nice, and they had me very relaxed. And by the next morning, they had sent the results,
Okay.
and everything they showed that there was no signs of cancer.
Okay. So what is your opinion on this treatment?
I would recommend immunotherapy to anybody, and in fact I have told several people about it. A couple of my friends who even knew people with cancer, and I spoke to them and I told them what my experience was with it, and I recommended them to Dr. Bora, and I will never stop recommending them, because to me it's the immune system that is actually fighting the cancer, and there's no chemotherapy or radiation that kills even the good cells. So, and that to me is the biggest thing. I'll say it's natural in the sense that it's your body at work. So I recommend it any day of the week.
Yeah. So this is about one of the patients who talk about this, and we found, and his follow-up test we found very encouraging. We can able to activate good lymphocyte defense mechanism patient by using patient's own cells. So we feel this is one of the best treatment in solid tumors, specifically in case of prostate cancer. We found good results in other cancers too. So it's one of the good treatment, maybe combination with the chemo and radiation in advanced stage of the cancer when patients having high tumor load. But in early stage, or especially in combination with the surgery, we found good is one of the best treatments.